In our last video we described what cervical cancer is. A brief recap: cervical cancer is a cancer of the cervix, the lower part of the uterus or the womb as we all know it, that connects to the vagina. It is the fourth most common cancer among women worldwide. The vast majority of cervical cancers are caused by infection with a virus known as human papillomavirus, HPV. HPV is a sexually transmitted infection, STI, like the common HIV, and it can be transmitted through vaginal, anal, or oral sex. HPV can also be transmitted from mother to child during childbirth. Not everyone who is infected with HPV will eventually develop cervical cancer. However, the risk of developing cervical cancer increases with the number of HPV infections a woman has. The progression of HPV infection to cervical cancer is a multi-step process that can take many years. The first step is the infection of cervical epithelial cells with HPV. The virus then integrates its DNA into the DNA of the host cell. This integration can lead to the production of viral oncoproteins, which are proteins that can promote cancer. The next step is the development of precancerous lesions, such as cervical intraepithelial neoplasia, CIN. CIN is a condition in which the cells of the cervix are abnormal, but they are not yet cancerous. CIN can progress to cancer if it is not treated. The final step is the development of invasive cervical cancer. Invasive cervical cancer is cancer that has spread from the cervix to other parts of the body. Let's describe in more details the steps leading to cervical cancer from HPV infection. So first off, HPV infection. HPV is a virus that can infect the cells of the cervix. The virus enters the body through small tears or abrasions in the skin or mucous membranes of the cervix. Once HPV enters the cell, its DNA integrates into the DNA of the host, or infected individual, cell. This integration can lead to the production of viral oncoproteins E6 and E7. These are proteins that are capable of causing cancerous growths. The viral oncoproteins E6 and E7 can promote cancer by inactivating two tumor suppressor proteins, p53 and retinoblastoma, PRB. As the name implies, these proteins work to suppress the development of cancers, so the oncoproteins first inactivate them, so the risk of cancer increases. Next is the development of cervical intraepithelial neoplasia, CIN. CIN is a condition in which the cells of the cervix are abnormal, but they are not yet cancerous. CIN can develop as a result of the production of viral oncoproteins. CIN can progress to invasive cervical cancer if it is not treated, and this is common as most women do not regularly screen for such cancerous lesions. Invasive cervical cancer is cancer that has spread from the cervix to other parts of the body. It is important to note that not everyone who is infected with HPV will develop cervical cancer. However, the risk of developing cervical cancer increases with the number of HPV infections a woman has. Women who are infected with high-risk HPV types are at an increased risk of developing cervical cancer. There are a number of things that women can do to reduce their risk of developing cervical cancer, including 1. Getting regular Pap smears. Pap smears can help to detect precancerous lesions before they develop into cancer. 2. Getting vaccinated against HPV. The HPV vaccine can help to protect women from infection with high-risk HPV types. 3. Avoiding risky sexual behaviors. Women can reduce their risk of HPV infection by avoiding risky sexual behaviors, such as having multiple sexual partners and not using condoms. If you are concerned about your risk of cervical cancer, talk to your doctor. Your doctor can help you to assess your risk and recommend appropriate screening and prevention measures. So that's all for today in our cervical cancer series on Crazy Medic Files. We will be back again to talk on the diagnosis and management. Till then, endeavor to get yourself screened and vaccinated against cervical cancer.